A lot of questions about the H1N1 virus, the swine flu, and all that sort of thing going on across the country, I guess, in the last 24 hours. Joining us via telephone this morning is Dr. Arlene King, who's Ontario's Chief Medical Officer of Health. First of all, Dr. King, thanks for joining us this morning. We appreciate it.
Good morning.
Tell us, first of all, about this strain of flu. And is it H1N1? Is it swine flu? What exactly is going on?
So we've had one Ontario resident that has been confirmed as being infected with what's called an H1N1 variant flu virus. Now, this virus normally circulates in animals, and when it goes from animals to people, we then refer to it as a variant virus.
Right, right. Now, this is unusual, is it not, for it to go from animals to people?
Yeah, this is it's really very rare. It is probably an isolated case, and the reason we know that is because we do investigations around all of these to determine whether or not there is any spread at all. And close contacts of the case have been identified. They've been followed up, and to date we haven't identified any additional infections. And we also just know from experience in the U.S. where they have had a number of these identifications that they do only rarely jump from livestock to humans, and then even more rarely from person to person.
Right, right. They've had, what, 300 cases in the United States, something along those lines?
They have, yeah, various different types of variant viruses, but yes, they have had a number of these recently.
I was talking to some friends of mine in Alberta yesterday, and it seems this is a concern right across the country now. Is this anything to be worried about?
Well, as I said, the risk to the general public is extremely low, and we have investigated this, and we have not found any infections in any close contacts or in any other individuals that are even exposed to swine at this point in time. So the risk is extremely low.
Right.
And, it really is probably not of a general public health concern.
This is the time of year, Doctor, when we start thinking about the flu and the flu shot and so on and so forth. Do we know any strains of flu that are headed our way during the winter months that we should be aware of?
Absolutely. Every year we know that we're going to get human flu viruses that circulate around the globe in a very predictable manner. So it's very important that Ontarians get immunized against the seasonal flu viruses that circulate with our flu shot. That protects against 3 strains of flu, and it's very important in anyone over the age of 6 months of age.
Yeah, it should be pointed out that this is something your department and others monitor when it comes to flu strains and so on, and viruses that are approaching that people should be aware of. And when people get the flu shot, it's designed to protect against those, correct?
Yes, absolutely. And I think that the identification of this isolated case is the result of the strength of our monitoring system here in Ontario. It really isn't an unexpected occurrence in light of the fact that there have been a number of these infections in the United States over the last year. Right. And we do very close monitoring for flu viruses in general to detect anything new. And so this is, again, not unexpected.
Exactly. And people should be aware that washing your hands and taking all those precautions is a good measure to take when we're headed into flu season, right?
Absolutely. In addition to getting the flu shot, which is the best defense against the flu, specifically hand washing is the best infection prevention measure against all other respiratory viruses that also, unfortunately, circulate during the winter months as well.
That's right. Dr. Arlene King is the Ontario Chief Medical Officer of Health. Doctor, we want to thank you for your time this morning. Appreciate the information.
You're very welcome.
Have a nice day.
Bye-bye.
That's Dr. Arlene King. So there you have it. When it comes to this swine flu, this H1N1 situation that involves one person here in Ontario, really nothing to be concerned about. What Dr. King is saying more than anything is that you should be more apt to protect yourself against the coming flu strains with the flu shot and so on than any other sort of swine flu. That's good news.